Well, welcome to this webinar, When Less is More, My Experience with IORT, where we will hear from 5 breast cancer thrivers about their experience of having oncoplastic surgery and intraoperative radiation therapy for breast cancer. We are highlighting innovation and patient-centered care in this webinar. I'd like to acknowledge the Ken Johnson family in memory of Joan Brierton Johnson for their generous support of this and prior webinars. And I encourage our viewers to also check out 2 key webinars that give the medical background for both oncoplastic breast cancer surgery and intraoperative radiation therapy, or IORT. I am Rebecca Crane Okada, a clinical nurse specialist in breast oncology and program manager for the Willow Sage Wellness and Clinical Support Programs of the Margie Peterson Breast Center at Providence St. John's Health Center and St. John's Cancer Institute. I am pleased to be joined by these 5 dynamic women who will share their story. And I want to welcome each of you, Christy, Sarah, Carrie, Rochelle, and Patricia. So I invite you to introduce yourself and say a little bit about your journey when you were diagnosed. Anything else that you'd like to share to introduce yourself and let the viewers know you a little bit. Christy, we'll start with you.
Well, my name is Christy and I qualify for Medicare. And I found my lump in the right breast during a self-examination. And subsequently, I had a 3D mammogram and a MRI with contrast so they could see the cancer. I had no trouble deciding where to go. My internist, our internist for 35 years, thought very highly of Margie Peterson breast cancer, and he's always led us down the right path. So that's why I decided to go to Margie Peterson breast cancer.
Sarah?
My name is Sarah. I was diagnosed on March 3rd of this year. Also, like Christy, my experience with my doctors previously at St. John's led me to the decision that I had no other choice. I needed to be with the St. John's people. And I was diagnosed in a regular mammogram. My radiologist was very hesitant to say whether there was something there or not because it was so small based on the mammogram. So they did an ultrasound and they found a very tiny cancer. And by March 10th, I was having surgery at St. John's.
Patricia?
I was diagnosed March 3rd of 2021 and had the surgery March 31st. And I cannot tell you how grateful I was to have the opportunity to use the IORT because it got that cancer out of me as fast as it could. And it allowed me to heal without going through any more surgery. So I chose St. John's because I was a new member of the group and I was recommended to Dr. Grumley through my primary care physician who said she was just great. And from the moment I met her, I trusted her. I trusted her very skillful way of speaking to me without sugarcoating anything. And she suggested the IORT, which I chose. So I am very grateful that this process was so very easy in the long run.
Thank you. Rochelle?
Hi, I'm Rochelle. I'm 78 years old now, recently. So I was diagnosed on April Fool's Day, but it was no joke. And had surgery May 12th, so just about 5 weeks after. I was lucky enough to know absolutely that I wanted to come to St. John's because I had been through numerous places with my brother who had cancer several years back, and he had treatment ultimately at St. John's, and it felt so warm, excellent doctors, but it was small enough that I never felt like he was getting lost there. And I knew absolutely, without looking around anymore, that I wanted to come to St. John's, but I did not know the surgeon there. And my cancer was discovered by mammogram. I don't think I said that. And I asked the radiologist, I said, I want to go to St. John's, but do you know what surgeon? And he said, well, ask your oncologist, but if anyone mentions Dr. Grumley, go no further. And later I asked 3 other people and they all mentioned her first. So it was a very easy choice.
Thank you. Carrie?
Hi, my name is Carrie. I'm 67 years old, and my surgery is fairly recent. I had my mammogram. I had just my yearly checkup, and that was in June 10th. And then the radiologist saw some calcification. So as soon as possible, within 2 weeks, I was able to do a biopsy to make sure what kind of calcifications. And so we did see, or she saw, that they were in the it's called DCI in the duct, which was a perfect candidate for intraoperative therapy. And so how I came to St. John's, I had had surgery in March 31st, another surgery for my hip replacement at St. John's. I loved it there. It was quite an ordeal, and I felt so great about the experience there. So when my radiologist said, I suggest a few doctors at St. John's through Margie Peterson Center, and she gave me Dr. Grumley's name. My husband's doctor said she was amazing. So I did a little bit of searching around, but the radiologist and his doctor just said, don't go any further. She's an A+. So my experience with her and the whole process was early on, detective right away, simple, and she was really great to work with. So that's how it all started for me.
So I'd like to ask you, when you were first diagnosed and you saw your surgeon and the rest of the team, what treatment options surgically and radiation were offered to you? Can you speak a little bit to that and your decision-making process?
When I first went in to see Dr. Grumley, she looked at my mammogram and the ultrasound and saw that it was very small. And so what she said to me was, here's what I would recommend to you based on the size of your tumor. You're the perfect candidate for IORT and Oncoplastic approach to make sure that my breast came out looking the same after the surgery. And I have to say, I was in such a panic about the whole thing and so totally stunned that I don't think I absorbed anything that she said. And I just sort of said, well, whatever you can do to get it out and get it done fast. My husband was there with me and he later told me a little bit more about the procedure, but there was never, the only thing that she said that might happen later on is depending on what the margins look like in the pathology, they might have to do post-surgery radiation, which I didn't have to have, but there was no question in my mind that I wanted to do the IORT. And I did do a little bit of research on it afterwards, and I found it sort of fascinating. This technology existed to help breast cancer patients get through their surgery without having to go, or at least a good chance of not having to go through radiation. So there was no doubt in my mind that that's the way I wanted to go.
Mm-hmm.
Well,
Carrie, can you speak to that a little bit?
Well, for me, it was so simple, and what I liked was it was just one shot. So while you're in surgery, you get that dosage of radiation right then and there, and it didn't like was discussed before, we don't know if we're going to need more radiation. But what was nice about it is if we didn't, you wouldn't have to be going several times later, and the convenience of going to appointments and also having side effects. So that for me was a big deal.
Mhm. Rochelle, I'm sorry you had your hand up.
That's okay. I'll say for me too, like Sarah, when I went to see Dr. Grumley, and honestly, I absorbed also very little of what she was saying. There was a lot of information, which I was very happy that she knew. And I was totally going by my intuition about her, and listening to her and feeling her out. I just felt like she was very caring. She was very thorough, and I was going to go with whatever she said. And when she told me about intraoperative radiation, what I remembered was that it sounded so easy. And in fact, when you asked me if I wanted to be on this panel, I said, well, I have nothing to say because I didn't know I had it really.
Yeah.
And it was exactly as she said, no side effects. If I was going to need radiation later, I do remember that she said it would be a week less of external beam radiation. So it seemed like, there was absolutely no reason not to choose it. And I was also surprised that she started talking to me about rebalancing the breasts, because I thought, well, I'm 77, who cares what my breasts look like anymore? It turned out I did care. And the other fortunate thing was that when I said yes to that, the pathology on the left breast showed another cancer. So I had bilateral cancer, which was a surprise. They had not seen it on the mammogram at all or on the ultrasounds. And so they went back, and I had a second surgery, and they did a resection. And I had intraoperative radiation on the second breast as well. So it was all very fortunate, just listening to my intuition and following her advice.
Patricia, you had your hand up, and then Christy.
Well, I just wanted to add to what I said before. I didn't go in just see her and choose her. I actually went in all around the universe, investigating every possibility for why this was happening and what I could do that was not surgery to get rid of this thing. But within a week or two, I started to panic, and my driving force was just get it out of me. So I soon came around to the surgical option, but I did think of lots of alternative therapies, researching them, and finally called an old doctor friend of mine who specializes in breast cancer. And she walked me back down the ladder and through all the steps again. So I actually heard Dr. Grumley's presentation, and then I heard my friend's presentation. And it was only hearing it the second time, third time, and fourth time that I finally started to understand what was going on, because I was just in this swivet, a panic, a disbelief that this was happening to me. And, I think it's a common shock that a lot of people have, but it was really, even on the day of the surgery, I did not know that they were going to touch my other breast. I thought she was drawing on my breast so that she'd match the one that she was playing with, the one that she would operate on, and bring that up to the level or down to the level of the other nipple. So she's drawing on me, and I'm kind of chuckling. I'm saying, you're very thorough. This is going to be very interesting to see if you match them. No idea. And then the nurse said, no, she's going to touch both breasts with a knife. And it was in the moment of the operation that I finally got that. So even though I had the diagrams and we drew on them and talked about realigning them, it didn't happen until the day of surgery that I knew that was happening. So if you're feeling at all, out of it, it's very natural, and just keep asking questions till you understand, you know.
Good advice.
Yeah, it was.
Christy?
Well, I had a different experience because I guess I'm a little skeptical. And when Dr. Woolman was explaining the mechanics of the machine, that Dr. Grumley would remove my nipple and then take the cancer tumor out, and then the machine would come over and distribute the radiation. And I thought, on my exposed tissue in my breast. And so I asked if I could come see him later, because I said, I have some questions. I'm a little uncomfortable with the idea of any radiation on my exposed tissues. So when I went in, he explained to me that, first of all, the IORT reduces the risk of damage to your heart and your lungs and your rib cage. And the 7 to 15 minutes that it's over your breast distributing the radiation is equal to anywhere from 1 week to 5 weeks of the external radiation. So that convinced me. And then he walked me down the hall and he said, I'll introduce you to the physicist. I said, the physicist? This is the gentleman who takes all of the measurements that come over the machine that distributes the radiation, and he has a PhD in physics. I thought, okay, everybody seems to know what they're doing. I'm okay with it. And then from that moment on, I was, an IORT believer.
Right.
Yeah, this is not a new process. As I understand it from Dr. Woolman, it's been in use for over 10 years. So
Right.
sometimes the insurance companies will give you a hard time about this being an unusual process or something that they don't insure. And so I was told maybe there'll be a delay in being able to get this for you, but in the past we've been able to get permission to use the IORT. And so I sat down and wrote the fanciest letter I could think of to convince them that if they use the IORT with me, that I was such a good candidate that I would cost them much less money. So it was a very rational letter of, intent. And by the way, I'm requesting this. If you make me wait for 60 days to get approval and the tumor gets larger, I'm going to be very upset. So let's just do this thing. And we had approval 2 days later. So I don't know if I had anything to do with that, but it became important to take advantage of this less invasive process of the IORT that would be one and done. That was the dream, that you could have this done. You would be under anesthesia. You would never experience the anxiety of going into radiation if you didn't need it, if your margins were clean. And so it became something to be hopeful for. And I was really excited to get that.
And I think for the viewers that are watching this, we do work very carefully with the insurance companies to request authorization when it's needed and really work that through. So we support our patients in that process when it's required. I know that one of you on this panel did have to have additional radiation. I think all of you mentioned that you went in knowing that was a possibility. Christy, could you speak a little bit, because you did have to have additional radiation?
Right. So my tumor ended up being quite a bit larger than they anticipated, which Dr. Grumley had warned me could happen. And so they explained that I needed to have an additional 16 days of the external radiation. And when they explained that, I thought, they said, it's like a bad sunburn. And I, being a Southern California gal, I've had lots of bad sunburns and even blisters. And I thought, oh, okay, this won't be a big deal. And I waited a month after the surgery and the IORT for everything to heal. And then I went in and I had the 16 days of external radiation. And even at that time, I thought, well, this is easy. This has been such an easy journey. And Dr. Woolman had said, well, you're going to get blisters and you're going to get a little red, you're going to itch, you're going to be uncomfortable. And he was right. I mean, there were blisters everywhere and it was itchy. It was very unattractive. I wore my shirts like this because I looked like my chest had been in a fire. It was really quite unattractive. He also said, you may be tired when you're finished with this treatment. Well, I walked out on the 16th day after they rang the bell and said the little poem, and I felt pretty good. And then about 2 days later, I was like, whoa, I couldn't get out of bed. I was exhausted. And I called him, and he said, well, that's one of the, reactions to the external radiation. So I'm really a believer in IORT now, because when I walked out after that surgery and that treatment, I felt fine. But the external radiation, does a number on your body, especially 16 days. And it takes a while for all the blisters to go away. It takes a while for the itching to go away. And it took me a couple of weeks until I wasn't so absolutely exhausted.
How are you feeling today?
I feel great today. Well, it's, after the 2 weeks of being so tired, I recovered, and, the surgery went great, the IORT went great, and the radiation went great. So I'm feeling great today.
Mhm. So some will need additional radiation and some of you did not. In terms of recovery from the surgery and IORT, how was that for you?
I have to say, for me, it was extremely easy. I had asked Dr. Grumley, when can I start doing my normal activities? Because I'm sort of a fanatic exerciser. And she said, the only thing you can't do is lift heavy weights, because you don't want the scars, anything to happen to the incisions. And within 2 days, I was back doing my normal routine on a spinning bike and kayaking. And, I thought it was a very easy recovery. And the IORT was sort of a non-incident. It was just the one and done. It was a miracle. It really was, because you're in, you're out, and then suddenly you're back to normal. And it's a little bit of a surreal feeling when I say to myself, oh, I had breast cancer. And I had had another kind of cancer before with a very similar result, but I thought this was so much more emotional to me for so many reasons. I thought it was going to take me a long time to physically and emotionally feel better. And dealing with people at St. John's, and in addition to being kind and caring, Dr. Grimley's so direct and so matter of fact that you feel like, oh yeah, this is all going to be okay. And so far it has been.
Mhm.
Yeah,
Rochelle?
sorry. I just want to add something that just occurred to me, and it was that Dr. Grumley had so much humor that was very comforting to me, because I thought when I found out I had cancer, and I had been feeling fine, and I remember I had read this poem about that had a phrase in it about death rattling the doorknob. And I thought, oh, now this is it. Death is rattling the doorknob. And I said something to her jokingly when I met her about, well, everybody has to have some ticket out of here. So, and she said, I don't think this is going to be your ticket out of here.
I will.
It was funny. She just kind of went with it. And then after the surgery, she said something about, well, when you take this bra off, you're going to be surprised at your nipples pointing toward the ceiling. And it was funny, it just sort of normalized everything and felt very light, and like it really was no big deal. And it really wasn't.
Mhm. Carrie, or Christy, what you were jumping?
Well, I was going to say, talking about Dr. Grumley's humor, when she came in before the surgery and drew on my breast, and I said, oh my goodness, you're going to draw on my breast. She said, now don't get excited. You're not going to look like a 12-year-old. And I said, well, that's probably a good thing. Her humor was wonderful.
Yeah.
So Carrie, getting back to the recovery after surgery, how was that for you?
For me, similar to Sarah's, it was very simple and easy going and just really quick. I did have the tingling sensations, the needling feeling in the breast, kind of waking up, but there's still sensation in the nipple. And then like the ladies are saying, Dr. Grumley was really, besides funny and humorous, she was confident and very meticulous with the drawing on the breast, because she wanted to make sure that the left breast, my left breast was larger than my right breast. So she wanted that symmetry, and she was drawing and going to it. And she, as everyone's pointed out, she really cared about how everything was going to look, because she knew later on we were going to care about how we looked. We were still like caught up. I mean, I was a little bit in shock, and like, here I am getting ready to go into surgery, and I just want to be okay. But when you're okay and you know that the cancer's gone and you can relax and your body's healing, and the added, assurance that your breasts look good, if not better than they were before. She was great at really taking that into consideration.
And as you're noting, the IORT is given while you're asleep in the operating room under the knife for the breast cancer surgery, but you're really unaware that it's happening. And so when you're going home after the surgery, you're pointing out that the recovery is really from the surgery.
Yeah.
You're not saying that there's any additional tiredness. Patricia, do you have anything to add here in terms of how you felt right after the surgery?
Yeah, I felt, I was just writing about this morning. I felt really very, very calm. I was really happy with the idea that I was finished with the cancer. And I was so grateful for what St. John's has in this breast cancer center. I just wish they had for all medicine, because the ability to wake up in a room that's quiet and with low lighting, music on, not too many people around, and this very serene sensation. I didn't preview the recovery room. I just woke up there, and I felt like I was in a spa or a resort. It was really crazy. I said, where am I? And the music was lovely, and the smells were nice, and the nurse was quiet. And I couldn't believe where I was. I just felt like I was not, for the whole for the whole breast cancer center and the orientation and the way it's has a garden around it, and it has a quiet nature, and there's pretty much women there. And it's just so nurturing. And I felt that in the post-op directly after the surgery, that I was going home that same day. It was an outpatient procedure. How does that happen when it's the big C, And it was, I'm going home that night. I'm going to sleep in my bed, and I have this place where I'm snoozing and resting and sort of getting an idea of being reoriented in a world of a healthy person. I just can't tell you what it did to not be in a hustle bustle of a recovery room and the bells going off and the noises, to be in a really quiet place. I felt like I was just being born alive again, that I was not going to be dying, that I was recovering, and that this technology was here and we're able to have that in our lives. And I just felt this incredible wave of joy and being in the moment, and all my senses were firing. And I slept like a baby that night, and I woke up almost in tears of relief that this anxiety was just gone. It was the physical text, the tumor was out of my body. The radiation had happened, as Dr. Woolman explained the radiation, and as the booklet explained, and as the videos explained. It was a ball. It was like a ping pong ball. And the radiation emits in a circle from the ball. And what happens is it only goes a very small distance into your chest. That's why it protects your lungs and your heart, if it happens to be on that side. But when you have external radiation or other things, they can be more aggressive in terms of touching other parts of your body. This IORT is like a little ping pong ball. It emits a small amount of radiation to make sure the tissue that they took out has a margin that's also clean. And then your whole breast, Dr. Woolman explained it. He said, it's like having your breast sterilized. And I completely understand that you don't just take out the dirt off of panel, you swipe around it and make sure the area around it is clean as well. And it was just such a simple way to understand it that I really appreciated that. And then Dr. Grumley explained exactly how she was putting our tissue back together and what those feelings would be. And I have kind of an analytical mind or an engineer's mind. I love the details. And when I can visualize what's happening, I can sit there and meditate and heal that tissue with my mind. And that was the long answer. Sorry, John.
It was interesting.
Well, Christy, you talked about how you're feeling. Now I want to hear if there's anything you want to add, and then also hear from the rest of you about how you're feeling now. Some of you are a while since your surgery, and Carrie, it's pretty recent.
I will say that I'm a sailor, and when I went into Dr. Woolman, my big concern for the external radiation was that I would not be able to sail. And he was wonderful. He said, just wear a big hat and cover up, go out and sail and forget all about those bumps on your chest and the itching. And, Dr. Grumley was the same way after the surgery. I said, can I go out and sail? And I think I had to not sail for about a week. But she said, resume your life. We want you to go out and enjoy life. Forget about the cancer. We got it out. You're healthy. Everything's good. And all three of the doctors, the oncologists too, had such a positive, uplifting attitude that it was difficult to feel sorry for yourself and get down. You just thought, I'm going to be okay.
Sarah?
I am feeling great. I mean, it is like it never happened in a weird sort of way, except when I look at my breast and I'm like, oh, right, I had breast cancer and I had surgery. But all the feelings back to normal. I'm doing all of my other normal activities. I am wearing halter dresses for the first time in 40 years.
Oh, me too. Me too.
Yeah, which is fun.
Mm-hmm.
And I'm grateful to everybody there for making it an experience that, as terrified as I was, they alleviated so much of that with their calmness. And I actually had to stay overnight because they had some emergency things. So my surgery ended up being at 6 o'clock. So they made me stay overnight, and the quiet, and like I said, I've been there before for a number of different things, and that also brought me out of my terror. When I woke up and I was like, oh, they took care of everything, and we had the IORT, and I was a little nervous about what the pathology would show, but she also, Dr. Grumley had also said to me, this is not going to be the way you die. This is not going to kill you. This is, something else along the way, but not this. And so I'm really back to normal mentally and physically, without any, other than the way they look, without any sort of feeling that that this is going to keep going or this is going to recur. They made me so calm about everything. And the fact that the IORT was a non-incident. I mean, it was just a part of the surgery. Like somebody, I can't remember who said it, one and done. You've got everything done at once. And I wasn't red. I thought, oh, maybe I'm going to get red from the radiation, but because I didn't really pay attention to the details, as I told you. But there was nothing. It was like, did they do this? Oh, so I feel great.
Yeah, I'm going to just add that I opted for it a second time. And in fact, that was after finding out it was so easy the first breast, when I found out that I had to have another surgery because of the pathology report. It didn't worry me at all because of the whole experience the first time. I was like, okay, sure, do it again, but can I have intraoperative radiation again? And they kind of checked and said, yeah, you can, yeah, no reason why you can't do it again or do it on the second breast. So sure, and I feel fine too. And Patricia, you were talking about the recovery room, and I agree, it was very soothing. But I also want to say, we didn't mention the nurses before surgery, and I found I found the nurses so wonderful and easy to be with. It was sort of like a bunch of new girlfriends. And that was very sweet to feel the sense of security going in. So I just want to say that that was important to me as well.
Thank you for saying that.
It's true.
Carrie?
Well, I agree. I think the nurses are amazing from the beginning to the end, before and after surgery. But what I was going to say is, when you first hear that you have cancer, you go through a shock, a feeling like, how big, how much. And so that anxiety settles in and you try your best to be calm. And I think for the most part, in this day and age, we know to stay calm, but there's the unknown of what the future is going to hold. And as you get closer to, because I had a biopsy and the pathology from that, and all that leads up to Dr. Grumley explaining what's going to happen, and that confidence and support from that whole team, the big booklet that you read, the more you know, the knowledge as that's coming to you, the more you can realize, okay, I can handle this, and these people do know what they're doing. And the other thing is not to be afraid. I know there's going to be a certain amount of fear, but really, this is, in this day and age, we know so much. The doctors are skilled. Science has come so far. Places like St. John and the doctors that work there really have it down to, the littlest detail. So we were in great hands. I mean, it just was something to know that God forbid we would ever have to do this again, but that it can be handled, and we're not going to fall apart from this or die necessarily. And I think that's important to remember. When you are first diagnosed, it's scary and you are in shock, but you can get through this because of the help there. And we're all doing great now.
Yeah, you are. I know we in the previous discussion we had, you talked about some pleasant surprises or perhaps some additional good things that came about because of this surgery. And some of those are related to any sensory changes and your sense of femininity or attractiveness. Would anyone like to speak to this on any level?
Well, I'll say when I was being rolled in for the first surgery, I just wanted to get the cancer out. And my sister-in-law said, "Oh, you're so lucky, you're getting a boob job." And I hadn't really thought about it, but post cancer surgery, I look pretty good. I look a lot better in a sweater than I did pre surgery. So I think, there's positives. Another thing I wanted to say about breast cancer that I was thinking about, it's different because you don't feel sick. It's not like you have the flu and you're achy or your nose is running. You feel great, and then you find a lump through the self-exam or you see it on the mammogram and you go into shock. You're kind of numb because you think, but I feel fine. And it's a very strange, different kind of cancer to have. But we're all doing great now.
That's for sure.
Oh, go ahead, Carrie, go ahead.
Well, I think there was a little bit of fear of disfiguration, and Dr. Grumley really assured what we were going to do. But it was important for my marriage and my intimacy to look as good as I could be. But I felt a little vain about that. And when Dr. Grumley assured that was normal, it was good that we were talking about it because, we wanted the cancer out first and foremost. And you wanted to say, okay, how am I going to look? Well, she made it very comfortable, and my husband was really very supportive. And it was a little scary at the beginning, and I felt comfortable after we went through everything.
Patricia?
I think I wanted the cancer out, and I'm 72, and I thought And I have a lovely relationship with my husband, and he's very supportive. So what else do you want out of life? And so I didn't really care about what the breast looked like, my breasts looked like. And afterwards, I just look at my breasts all the time. And I went out, I got some fancy bras at Victoria's Secret. I never go there. I go, to another store or buy sports bras at Costco or something. I'm wearing bras that are pretty and I feel pretty. And I have worn a halter dress without a bra, first time since I was in my 20s. And it's just an amazing thing. I feel physically much younger because of how I look. And I had just closed that door a long time ago, big sweaters, look your age, dress your age, act your age. And that's kind of gone. And it's because she moved my nipples. And I just can't believe I'm that shallow, but it's a wonderful feeling,
Sarah?
I mean, I had actually, before all this happened, I had thought about going in and getting a breast reduction because I was so tired of having such big breasts, and talked to a friend of mine who had had a breast reduction and told me all the pain she had gone through and all this kind of stuff. And so it was very ironic in a lot of ways that going through breast cancer actually gave me my reduction without a lot of pain. And I look at myself and I'm like stunned that, that this is me. It was in the beginning, it was very eerie saying, is this my body? Because you're so used to looking a certain way. And then suddenly, you go through this sort of terrifying experience and you come out with this very little positive, not little positive, but very positive sort of, almost, I was sort of elated when I first saw my breasts afterwards. I was like, oh my God, I had breast cancer and now I have great breasts. That's sort of an amazing thing. And throwing away all the underwire bras and yes, wearing the halter dresses. Incredible. So and my husband looks at me and goes, wow, not yours anymore. But so yeah, it was a good experience.
Yeah, I'll just echo that. It felt like getting a nice gift of looking, having a younger feeling body, because when I was young, I had very small breasts and they got bigger with time. And now I feel like I have my youthful breasts back and without implants or anything fake in there, which was, would have made me feel not so happy. It's just all natural and smaller, and it does feel much more youthful.
Mhm.
So I'm
And
happy.
Any sensory changes that you've noticed?
I have a little numbness on the underside of my breasts. No sensation lost in the nipples, but I think I'm only not even 4 months out. So I expect that it will return.
Yeah.
The numbness goes away because I'm 2.5 years out, and Dr. Grumley gave me several exercises to keep stretching that area. And eventually you do have feeling back, but it takes a while.
Mm-hmm.
Yeah, I have numbness on the side of the breast that the cancer was removed in as well. It hasn't quite gone away yet. And I'm doing a lot of stretching also.
Right. And that helps.
Yeah, I do that with yoga too. So there's a little tiny bit of tightness, but not much.
Mm-hmm.
Yeah, I do that. I found the yoga to be very, very helpful, really slow, really methodical. And it really did, when the tissue underneath was ready to stretch, it did. And it just took time. It was very protective. And my nipples got super sensitive. I feel like a teenager. It's just, they're super sensitive to everything, to cloth, to being touched, to, the wind. It's just a riot. So
Wind in those halter dresses.
Yeah. Carrie, you're pretty fresh right now in your healing process. So do you want to add anything here? You're a little newer to recovery.
I'm still a little swollen. I swim. And so Dr. Crumley suggested a few weeks, 3 weeks. And so, but I'm getting slowly back into moving around and doing that. But it's just a sore and swollen, but oh my God, it's nothing, really compared to what I expected.
And what you're showing is that full recovery is expected and possible.
Yes.
Right.
I recognize we're nearing the end, and I'm wondering if you have any other words that you'd like to share, anything I didn't ask you that you might want to speak to, or guidance for another woman who might be facing this choice in a similar situation to yours.
If you are given the option to have IORT, just grab it, because it really is a miracle technology to be able to have the radiation internally and not have to go through radiation, or at least know that post-surgery radiation, if you have to have it, will be shortened by having the internal, the IORT. So that would be my recommendation.
And someone who had to have 16 days of external, I would definitely say, take the IORT and hope that it does everything that you need it to do, because the external radiation is uncomfortable and something that you have to go through, but take the IORT.
There's a video that Dr. Grumley and Dr. Woolman made about the history of treatment, and the last one being IORT. And it goes through what we went through, what was available in the 60s and 70s and sort of each decade. And this is a technology that's evolved, and it's getting better and better. And this to me is to just have such targeted radiation that you can have it only affect a small amount of tissue in the breast area is just a miracle, because they often talked about and Dr. Woolman talked to me about it, should there be external radiation, that there might be damage to tissue that would be in the same path as the direct radiation. And it could be anything from bone to spine to lung to heart, anything that would be in that area. And so to have this technology available now, it should be done as much as possible with other cancers, if that's a possibility. But if you have the option to take this, it's truly a game changer for recovering and resuming your life. Shockingly so.
Yeah.
I would say that along with all that, it's very, very important. You hear this all through our lives, but to go to your checkups, because of the technology, they can find it at such a small stage that we are all good candidates for IORT. And I think that if you just take care of yourself and go on your regular yearly checkups, you're going to be saving a lot of time and preventative health issues later on down the line.
I agree. That was the one thing. I was 1.5 years because of COVID. And when they found the first, dark tissue, they wanted to look at it further. And I didn't think a thing of it because my mother had lumpy breasts. I had dense breasts. Those were always the things that I heard. And then the next stage was, well, we now like to take a biopsy of that. And then I started to get a little concerned, but still with the history of my family, it was not going to be part of my life. So when it came back as a positive that I did have a tumor, that's when the shock came in. But I spent a good 1.5 months in kind of normal mammogram world and didn't think a thing of it. So do everything that's available to find these at an early stage.
My radiologist told me that if I had waited a couple of months because of the type of cancer it was, I would have had a very different outcome, very different treatment. I might not have been a candidate for IORT. I may have had to have chemo. The fact that it was the one appointment I kept because we were pretty locked in, my husband and I, during the really worst part of the pandemic. So, and I said, no matter what, I'm going to this mammogram. So that is going to your mammogram on time. Don't delay it is absolutely critical.
Michelle, you get the last word.
Well, I absolutely echo everything that everyone else said. And I would add that if I was giving advice to someone who was just diagnosed I would say really, really pay attention to your feelings of trust in your doctor. I have a friend who went to a doctor, who had a good reputation and just didn't tell her much. And she followed orders and she had external beam radiation and she had some heart issues from it. I said, well, did you ask your doctor thus and such? And she said, no. I mean, that was partly her, but I feel like it's really important to pay attention to your feelings of trust and safety about your doctor, because, I'm sure other doctors exist, like we all are huge fans of Dr. Grumley, but I'm sure there are doctors that inspire trust and doctors that don't. And boy, I'm really very strong on that advice.
Well, I want to thank each of you today for being part of this panel. Your wisdom, your experiences shared are definitely helpful to other women going through this, both information-wise and support-wise. So I want to thank Christy, Carrie, Rochelle, Sarah, and Patricia for being with us today. And I hope that if you want to reach out to us, you will look at the numbers on the screen, either call us, email us, or check us out on the web. We have a Facebook, LinkedIn, Twitter account, so you can follow us on any of those. And again, thank you to our panelists today for this wonderful, informative webinar.
Thank you.
Thank you.
Thank you.
You.